the long-term side effects of bispecific antibody treatment, and how will I be monitored for them after treatment ends?
So another great question. I think, when we think about the side effects in general, the bispecific antibodies and the CAR T both have those unique toxicities, cytokine release being the most common. And then you also have worry about the neurological toxicity. The difference is that depending on the specific bispecific or CAR T that you use, but we usually typically see these occur in lower grade or not as severe with the bispecific antibodies than you can see with the CAR T cell therapy. You can still have cytopenias and infection risk with these therapies. Whereas in chemotherapy, I mean, we think of that as more generalized toxicities with the cytopenias, with the risk of infection, with the GI toxicities. When we think about long-term side effects, so I think one of the important things to recognize is that bispecific antibodies have not been around that long in the scheme of things. So we can't say, the risk of 20 years, what do we see, or even 10 years. But when we think about what we have seen, we've seen things like the cytokine release, the infections, the cytopenias. But what we haven't seen is things like the secondary malignancies that we worry about when we think about chemotherapy or even maybe immunomodulatory therapy, those secondary cancers that patients can develop. I think for long-term monitoring right now, at least the biggest thing you want to think about is that these therapies do deplete the lymphocytes for a prolonged time. And so the risk of viral infections or reactivation of infections and making sure that that's being considered.